Thank you so much to everyone for being here this morning. And I just want to start by acknowledging we don't have a lot of details, but there seems to be a situation in Minneapolis this morning and an active shooter situation. And so we want to just send our prayers up for anyone who is involved, and of course our prayers for law enforcement who may be headed to the scene or at the scene here this morning. Thank you to everyone in healthcare who may be asked to respond as well. So thank you so much. Look, there are few issues more important to me than ensuring that all Minnesotans have access to affordable health care. I know the folks standing alongside me and behind me can say the same, and that's why we're here today, to stand up against the so-called big, beautiful bill that made the deepest cuts to health care in American history. This is incredibly personal to me. Many of you know I've told my story of growing up in a mobile home park to a single mom who at times in the history of our own family, we didn't have access to health insurance. So this is a deeply personal topic for me. I worked for 22 years in 2 healthcare manufacturing companies before I ever stepped off the sidelines to run for Congress. And so coming to Congress, one of the objectives that I had was to represent my constituents and to try and get access to health care for as many people as possible. I'm not going to sugarcoat it. Because of these cuts, too many Minnesotans will lose access to the health care that they desperately need, and even more are going to see their health care costs go up. The latest estimates put 140,000 Minnesotans in jeopardy of losing their health care coverage. Let that sink in. 140,000 of our neighbors. And right now, when you think about it, it's not that folks aren't going to come to the hospital when they need one. These healthcare facilities have a responsibility to serve our community when they're sick. It's just going to be uncompensated care that actually happens when we could be delivering preventive care that actually lowers the cost of health care in our country. I've always said that it's too expensive to be sick in this country, and that has never been more true. Having served on the leadership team of a major Minnesota healthcare company for years, I know that preventive care not only saves lives, but it saves money. Somehow that is lost on my Republican colleagues who voted to pass a bill that will take health care away from millions of Americans and skyrocket the national debt, all to pay for tax cuts. The majority of the tax cuts in this bill went to the top 2% in our country. Literally think about what they just did, that I voted against, by the way. They took the lowest 10% in our country, income earners, and they cut Medicaid, and they cut supplemental nutrition. Food, nutrition is health care in our country. And they delivered that benefit and value to the top 10% in our country. It doesn't make any sense. We should focus on cutting taxes for the middle class in this country, but that's not at all what my colleagues have done. Prior to their passage of the big ugly bill, I will not call it beautiful anymore, working Minnesotans relied on the Affordable Care Act premium tax credits to help pay for their coverage. Those tax credits are set to expire this November. And when that happens, health insurance premiums will increase for everyone in the marketplace. Let me be clear. When folks get their premium increases, I don't care if you're on MNsure or if you're on a private health care plan. I am telling you now that your health care costs are going to go up. You're going to be asked to pay more because the market is already starting to prepare for what's about to happen in $1 trillion in Medicaid cuts in our country. Over 143,000 Minnesotans rely on MNsure for coverage, and 90,000 rely on the premium tax credit. 90,000, 62% of Minnesotans enrolled through MNsure will see their costs go up in 2026, with premiums increasing by $177 per month on average for everyday Minnesotans. Those bills add up. And I want to give you an example. This is really insane when you think about it. Prior to the ACA tax credits, which I was proud to vote for, and I'm on a bill to extend those tax credits, I know a farmer in this district who paid, on Mincher, $28,000 a year in premiums for just him and his wife. He and his wife. Now they pay around $5,000 a year in premiums. That's an extreme example, but we're talking about people who grow our food and our fuel in this country who are being asked to pay that kind of money for health care in our nation. You may have heard the talking point from my Republican colleagues, those same Republican colleagues who won't show up to do town halls in their own congressional districts, that the current eligibility requirements for Medicaid aren't stringent enough to prevent freeloading and fraud. But let me set the record straight. Their bill is designed to increase burdensome requirements so that thousands and millions of people are kicked off their health care. Ironically, access to health care is the only way that many Minnesotans with disabilities, chronic illnesses, or mental health challenges are even able to work, but Republicans won't talk about that part. Let me say it again, because we can't stress the point enough. This is all happening to fund tax breaks for the top 10% in our country. And if you're in the top 10%, that's amazing, awesome, great for you. Pay your damn taxes. That's awesome. I'm pro everyone having an opportunity to be successful in this country. Working and middle-class Minnesotans, though, will die because President Trump and my colleagues in Congress, including the 4 representatives from my own state, are more concerned with lining the pockets of billionaires than they are with taking care of the people that they represent. I have often been named as one of the most bipartisan members of Congress, but I've often also been called a bit of a hellraiser because I will say things and do things that aren't exactly politically correct, even within my own party. But I'm going to always tell you the truth. And the truth is that this bill will raise the national debt by nearly $4 trillion over 10 years to pay for tax breaks for billionaires. So much for the party of fiscal responsibility. But I will tell you that I will not be quiet. I will not stand aside. I am going to be front and center in telling Minnesotans that your health care costs are going up because my Republican colleagues don't know a damn thing about health care in our country. The most correct thing that President Trump ever said was that health care is complicated. And if you remember, this is the same president and Republican Party who tried to repeal the Affordable Care Act over 60 times before I got to Congress. That is one of the reasons I ran for Congress, is because I will not stand as someone who didn't have health insurance in my own family at times for what they're doing to our nation. I'm not going to step aside. I believe that health care is a right, not a privilege, and that's why I will do everything in my power to make sure that Minnesotans are able to access and afford their health care. That's going to mean working with local and state elected officials, health care professionals and advocates. It's going to mean working with nurses' unions in our state and in our country who will stand up for the patients that they serve every single day in hospitals just like this. It's going to take every single one of us to guarantee that mothers and fathers and family caregivers like Carrie, who's with us today, have the support and resources that they need to continue to serve their families and provide life-saving care. Now is the time to step up and fight back. And I would ask every single Minnesotan to call your representative, to tell your Republican congressmen and women to extend the Affordable Care Act tax credits, to roll back the $1 trillion in Medicaid cuts in our country. Because if there's one thing I know as a mother, and more importantly, a grandmother of 3 little boys, that there's nothing more important than the health and safety of our families. So thank you again for being here today. I'm so honored to have these amazing advocates standing behind me, and I have the pleasure of introducing a tireless advocate for Minnesotans in District 41, where we stand, State Senator Judy Seeberger. Thank you again, everyone.
Good morning, everyone. I want to thank Congresswoman Angie Craig for coming to Hastings, one of the most beautiful cities in my district, to talk about this important issue. I'm Senator Judy Seeberger. I represent District 41. And Hastings is not only within my district, but we have beautiful Regina Hospital, which is now United Hospital Regina campus, that I'm pretty familiar with. I work as a paramedic, as some of you may know, and am frequently at this particular hospital, transferring patients or bringing patients in for the care that they need. And I want to tell a story about what has been happening, what I've been seeing in the last few months in the back of the ambulance. About 50% of the patients that I encounter don't want to be transported to the hospital because they're concerned about how they're going to pay for it. And that's not okay. When I'm in the back of the ambulance with a patient who has chest pain, or I'm in the back of the ambulance with someone who has been involved in a trauma, and they need to go to the hospital to seek a higher level of care, it bothers me that I have to reassure them that yes, you do need to go to the hospital. I'm not comfortable not letting you go to the hospital, but their only reservation is, am I going to be able to pay for it? That's not right. And that's not how we should be living in the United States of America. When we look at our aging population, those folks who rely on Medicare, when we look at our folks in the disability community or other communities that rely on Medicaid, they are entitled to medical care just like anybody else. And cutting those benefits, telling them that they don't have the coverage or they're not going to have the coverage that they need to treat their conditions, to monitor and manage their health, is cruel. So that's why I'm grateful. I'm grateful for folks like Congresswoman Angie Craig, who takes a stand, who fights for what's right. And I'm proud to stand alongside her within this district and throughout Greater Minnesota to ensure that all folks have health care, no matter their zip code, no matter their income, no matter their age, their socioeconomic status, their disability status, because everyone deserves health care. Again, I want to thank you for coming to Hastings, beautiful Hastings in my district, and I'm going to turn it over to Representative Bierman.
Thank you. Well, it's a fitting place to be here at Regina Hospital this morning to highlight the impacts of the big ugly bill, as it is called. And I appreciate the fact that this hospital is going to experience what all hospitals across the state of Minnesota are going to be experiencing, impacts from this bill. And I appreciate Congresswoman Craig coming to Regina Hospital to talk about it, to put a spotlight on it, to focus on it back in Washington as she does each and every day. As the co-chair of the Health, Finance, and Policy Committee at the state capitol, I will tell you that we worked very hard last session to address hospital stabilization. It was the #1 priority of our committee because we know the increasing headwinds hospitals have been experiencing for years. Low reimbursement of Medicaid, higher inflation, higher labor costs, and a growing burden of uncompensated care that has been mentioned. In St. Paul, we passed legislation to deliver stabilization, to improve Medicaid delivery, and increase reimbursement rates so our providers and hospitals could stay afloat. This Republican bill undermines that work. And it is astounding to me that when policymakers know that American healthcare systems across the country need an infusion of support, the Trump administration chooses to divest resources and add additional costly burdens to the state and providers. As mentioned, this is the largest cut in 60 years at a time when the need is greater than ever. There is no upside to this bill. The American healthcare system got a whole lot worse with its passage, and it will especially affect hospitals, rural hospitals, long-term care facilities, and they will feel these effects immediately. As mentioned, many people are going to be losing health insurance coverage, and where will they go for care? When they don't have coverage, their conditions worsen, and eventually they show up in the emergency departments of places like United Regina Hospital. They will significantly increase the uncompensated care costs for our hospitals further. And we all pay for this. We all pay with higher premiums, there are higher taxes in properties, and simply put, higher patient costs for the medical care we all need. In addition, as hospitals like this one lose revenue, they are less able to absorb those costs, putting all their service lines for the community at risk. And we see this, closures of service lines, closures of clinics, rural, urban, because of this issue. The bill also includes provisions that could reduce Medicaid funding by altering funds for arrangements for medical education. This is the very future of our preparation for the next generation of medical care. Now, this administration has declared their aim. Make America healthy again, is what they say. Their actual policy, though, this actual bill does the exact opposite, especially for the most needy, children, elderly adults, being cared for at home and in nursing homes. The question is why, and that has been answered. Tax cuts, moving to the wealthy. But remember, Republicans control government. They get to decide what policy they choose. And they are choosing health care, taking away health care for millions of Americans and giving those billionaires the tax credits. Medicaid cuts to support tax credits for the wealthiest among us are bad enough at this time right now, but I cannot talk about these cuts and the impact on hospitals without also mentioning the gutting of funding for scientific research, including $500 million for mRNA vaccine development. Cancer research has been gutted 40%, cuts to the National Institute of Health, which promotes life-saving research in all kinds of ways, from Alzheimer's to advancements in gene therapy. These cuts have stopped trials arbitrarily, and we risk losing the leadership, the medical discovery leadership the U.S. has had for the last 100 years. This is alarming, this is shocking, this is egregious. Pick your adjective. We should all be we should all be speaking about our profound objection to this, as Congresswoman Craig does each and every day, and I applaud her for being here today to do this. The Regina Hospital, the citizens of Hastings, the people of Minnesota deserve better than this. Fortunately, my hope is that with the fall legislative session, with enough phone calls, as was mentioned, we need lobbying, we need to keep promoting and talking about this crisis on our horizon, that we can get Congress to do something different in the next term. Thank you for being here. I appreciate it. And I think Jill is next.
Thanks, Representative Bierman. Good morning. My name is Jill Ostrem, and I serve as the president here at Hastings, Regina. I especially want to thank Congresswoman Craig for her leadership and for being such a strong advocate for patients, families, and the hospitals that care for them. It's a privilege to welcome you to United Regina Hospital. As a nonprofit, mission-driven hospital, we're open 24/7, 365 days a year to provide care to our communities on their best days and on their worst days. Last year, more than 120,000 patient encounters happened here in Hastings at our hospital campus and our clinics. Hospitals like Regina are also economic anchors and community partners. Our ability to continue to play these essential roles in our community relies heavily on federal health programs like Medicare and Medicaid. Without these programs, many hospitals would struggle to keep their doors open. Medicare ensures that seniors, who make up a growing percentage of our patients, can access timely, high-quality care regardless of income. It gives families peace of mind that their loved ones will receive the treatment they need. Medicaid is equally critical. It supports children, new mothers, people with disabilities, and working families, so they have access to care. It also underpins programs like behavioral health and maternal health, which are paramount to community well-being and are chronically underfunded. These programs, despite lagging reimbursement, are a critical funding mechanism to support healthcare systems and hospitals like this one, to provide access to emergency care, trauma services, and the things that our community needs. These services need to be available. no matter what. Hospitals are facing immense financial pressures. The rising cost of supplies, drugs, medical devices, and complex care for patients are higher than ever, and we're caring for patients with more complex needs than ever before. When people have coverage options, they can live healthier lives. It ensures they're not deterred from seeking health care when they need it. Payments that we receive from Medicare and Medicaid have always lagged behind the actual cost of care, and it leaves us with unsustainable gaps. And unfortunately, the recently passed legislation will only widen these gaps. Here at United Regina Hospital, we're committed to delivering exceptional care, and we cannot do it alone. Navigating this environment requires a strong public-private partnership. Strong and reliable federal health programs are crucial to ensuring health care access for everyone. They're the backbone of our healthcare infrastructure, and they must be protected and strengthened. We're grateful for Congresswoman Craig, Representative Seberg, Representative Bierman, and their work to continue to protect and strengthen the programs that ensure patients are covered and cared for, and that hospitals like ours can continue to serve for generations to come. And with that, I'd like to introduce Dan to go next.
Thanks, Jill. Well, good morning, everybody. I first want to thank Representative Craig for inviting me here today. Just a little bit about my organization, the National Committee to Preserve Social Security and Medicare. We're a nationwide organization with more than a million members, and we were first started in 1982 by then Congressman from California, Jim Roosevelt, who just happened to be the eldest son of Franklin Delano Roosevelt and First Lady Eleanor Roosevelt, the creator of Social Security. And so you might say that Social Security is in our DNA, but by extension, we are also advocates for Lyndon Baines Johnson's vision, which was created 60 years ago, which was Medicare, Medicaid, and the Older Americans Act. So that's all we do as an organization. We focus on our advocacy like a laser beam with members of Congress, and so that's something that we're proud of and we're happy to do. So many of you may know that Medicare pays for half of all long-term care in this country. For most people, it's the only game in town. And that's why cutting Medicaid by $1 trillion is going to affect long-term care. 2/3 of the people who are nursing home residents are covered by Medicaid. So what does cutting Medicaid to that magnitude mean? Well, it means that nursing homes are going to be receiving less funding, which means that some nursing homes may actually be in the position of closing, especially if they're already operating on the margin. It also means that states like Minnesota may be required to limit eligibility for somebody going into a nursing home. And then finally, one of the things that state Medicaid programs may be forced to do is to make nursing home residents and their families pay part of the cost of long-term care. And when you're talking about the Medicaid program, because people have to impoverish themselves to seek eligibility, and you're talking about a lot of middle-class people who are put in that position to impoverish themselves, they don't exactly have a lot of disposable income left over to pay for other costs that might be associated with a nursing home. So they're already working at a disadvantage. So another important aspect of long-term care is home and community-based services. Of the 6 million people in this country who use long-term care, 3/4 of them get it through home and community-based services. What I mean by that is they're either receiving care in the home or in a community setting like adult daycare. So why is it important? Well, first off, your quality of life is better. If you've ever had to deal with an elderly relative, when you give them the choice of going into a nursing home or staying at home, it's a no-brainer. They want to stay at home. They want to stay in familiar surroundings, and so that's where they're going to want to be. I would say 9 times out of 10, unless they have a severe disability where they can't be cared for at home, they're going to want to be at home. And the other part that's of huge advantage of home and community-based services is it's usually less expensive than being in a nursing home. So it's something that's good for the Medicaid program, good for people who need home and community-based services. But here's the thing that a lot of people don't know about home and community-based services. In the federal Medicaid law, it is an optional service, meaning that states don't have to provide it. And so states like Minnesota that are going to be cash-strapped because they're going to have to pay a larger share of Medicaid and pay a larger share of SNAP benefits. That means they're going to have less money to go around in total. But if there is a Medicaid service that can go, it's going to be home and community-based services. And so we're afraid what's going to happen because of the big ugly bill and because of cutting Medicaid by $1 trillion, a lot is that many states are going to decide either they're going to severely cut their home and community-based services or they're going to get rid of them altogether. So the advantage, the quality of life that one receives from being in a home and community-based setting is going to go away in a lot of states that aren't going to be able to provide it, and that's a real shame. So before I close, I want to thank Representative Craig for inviting me today. We haven't talked about it that much this morning, but Representative Craig is the ranking minority on the House Agriculture Committee, and she was a real advocate on trying to push back against the SNAP cuts, the food nutrition programs that were in the big ugly bill, and we joined her in that effort to oppose it. But we want to thank her also for opposing the overall bill and trying to do everything to recover from this monstrosity of legislation that's really going to undermine people's health and food security. And with that, I'd like to introduce my fellow advocate, Carrie Allina. Carrie.
Thank you, Dan. Good morning, everyone, and thank you especially to Representative Craig and our hospital hosts and all of you here today for the opportunity to speak about how Medicare saves lives. My name is Carrie Ottleman. I live in nearby Lakeville, and I'm part of a family of caregivers. Together we love and care for my son, Keegan, an Iraqi war veteran and father who was critically injured in 2015. Keegan sustained a severe traumatic brain injury that left him unable to walk, feed himself, or speak. He has limited control over his body and suffers from life-threatening seizures. He requires constant care and protection every hour of the day. When it was time for him to leave the hospital after nearly a year, we were told to place him in a facility, a nursing home. He was 34. For us, there was never a question. He belongs at home, surrounded by love, stability, and the people who know him best. His wife and children sold their home, we sold ours, and together we created one household where he could live his best life in the heart of our family. Simply put, Medicaid made this possible. Medicaid covers his medications, equipment, and the caregivers who help us keep him safe. But what it's really given us is something harder to measure, the chance for him to be present in his children's lives, to share in their laughter, and to continue being a husband, a father, and a son. That is what these programs mean. They're not just numbers on a budget line. They're lifelines. They are the difference between a family being torn apart and a family being held together. And that's why I'm grateful to leaders like Representative Craig, who understand what's at stake for families like mine. She has stood up to efforts to cut Medicaid and Medicare. She's worked to keep health care affordable and accessible, and she's listened to families like mine. Families who know from lived experience that survival, dignity, and happiness depend on these programs being protected. So I want to leave you with two truths from our story. First, Medicaid saves lives. My son is the living proof. Without Medicaid, he would not have the equipment, medications, or care that keep him safe at home with the people who love him. And that's why it's heartbreaking and frankly outrageous when some in Washington talk about cutting these programs. Cuts don't just trim budgets. Cuts cost lives. Secondly, dignity and happiness are non-negotiable. Keegan deserves both, and so does every person whose health and safety depend on Medicare and Medicaid. These programs aren't charity. They're survival, dignity, and happiness. On behalf of Keegan, my family, and countless others, thank you for protecting the programs that keep us safe and together. Medicaid saves lives. Medicaid isn't charity. It's survival, dignity, and happiness, and when we protect it, families thrive. Thank you. And back to our champion, Representative Craig.
Well, thank you to everyone for your remarks this morning. They were extraordinary. Carrie, special thank you to you. I've had the privilege of meeting Keegan and also seeing what it's like in your lives. A day in the life of caring for Keegan was one of the most biggest privileges of my career as a United States member of Congress. So thank you so much to everyone. So I'm going to conclude this press conference and just say, are there any questions that you'd like to ask of the panel before we depart?
Real quick, there's a rural hospital fund here. Can you talk about whether you think that's going to make a difference, number one, and number two, half that money is at the discretion of the CMS director. Are you worried about the distribution of that and whether it will be fair for all the states?
Yeah, on the Rural Hospital Fund, even my Republican colleagues know that that is going to be insufficient to cover the damage to rural hospitals in our country. You know, I was just up in Hendricks recently, and to just see how far it is for many of our people in greater Minnesota to be able to get to those hospitals. I am very concerned that we are going to see the closure of rural hospitals, and we know, all of us know, that that fund was inadequate. I'm very concerned that the head of CMS will deny on a discretionary basis those funds and will make the distribution of those funds political. You know, as a Minnesotan, we consider fairness important. And any time you allow politics to get involved in health care, it's just a damn shame in our country.
On an off topic regarding the shooting today, I've just been told that there are probably about 20 victims, some of them children. Do you have anything to say about that?
So I haven't heard that, but it's devastating for our community. We know that the proliferation of firearms in our community is keeping us from being safe in our own communities. And so any place of worship, any school, anywhere in our community where this kind of evil is able to proliferate is unsustainable as a society. And I'd like to learn more about what's happening there before I make further comments, but what a tragedy. And I'll just add, thoughts and prayers aren't enough. I just learned about the facts, so I don't want to say more. But when the leading death of young people is firearms in our country, we have a significant problem in our country.
Thank you.
Thank you, everyone. Appreciate you being here.